Hello, and welcome to today's webinar, Evidence at Your Fingertips, Tools to Inform Decision Making. I want to start by saying thank you to everybody who's joined us today to dive in deeper around this topic. Just a little background on county health rankings and roadmaps for those who might be joining us for the first time today. We are a collaboration between the Robert Wood Johnson Foundation and the University of Wisconsin Population Health Institute. I'm excited to introduce our presenters and guests today. My name is Ali Hevrella, and I'm a community coach with County Health Rankings and Roadmaps. Today I'm joined by my colleague Attica Scott, who will be answering your questions that you submit in the questions box. Hello, Attica.
Hey, Ali, I'm looking forward to today's webinar.
Great. I'm also joined by my colleague Jessica Rubenstein, who is a What Works for Health evidence analyst. Later on, she'll be jumping in when we get to the Q&A section. Hi, Jessica.
Hi, Ali. Happy to be here.
I'm also pleased to introduce to you Kelly Rodgers, who's the Executive Director of Streetsmart and our guest today. Hello, Kelly.
Hi, Ali.
And behind the scenes, Joanne Lee with Healthy Places by Design will be supporting and engaging with you, the audience. So you might see her name in the questions box. Welcome, Joanne. Glad you're with us.
Hi, Ali, and hello to everyone out there.
Great. So a little framing for today's webinar. We're going to discuss 3 questions. What is evidence? What is its role in decision making? And how might you include evidence in your strategy selection process to support local change? Then I'm excited, Kelly and I each will demo a resource that makes research and evidence accessible to inform your efforts to select strategies and inform decisions. I also want to lift up that immediately following today's webinar, there will be an interactive face-to-face discussion that Joanne will facilitate, and this will be an opportunity to continue the conversation on the ideas, resources, and topics that are shared during the webinar. And towards the end, on our final slides, we'll share how you can join us. We always look forward to our audience participation, and so as we begin, I'm going to turn it over to Attica to explain how you can interact with us using the Zoom features.
Thank you so much, Ali. And for the folks who were able to join us a few minutes early, you saw a video introduction to the webinar. So for those of you who are just now joining us, we'll do a quick overview of how you can participate in this webinar. If you have a question for our panelists, we ask that you simply click on the Q&A control. And when you do that, the Q&A box will open up. And here you can type in your question and then click send to submit your question. And you're welcome to send us questions at any time throughout the webinar. If you want to share an idea with all of the attendees, we encourage you to use the chat to make comments or to respond to questions that we may ask you during the webinar. To use the chat feature, click on the chat control. The chat box will open up, and you will type in your comments here. Then press enter to submit your response. You have the option here to chat with all attendees or with the panelists only. We ask that if you are comfortable to chat with all of the attendees so that the other participants can see the ideas that you are sharing with us. Thank you so much, Ali.
Great, thanks, Attica. So just want to begin by sharing a little bit more about what we at County Health Rankings and Roadmaps work to do. We support communities to bring people together to look at the many factors that influence health. Then we help them select strategies that can improve health for all and close gaps and make changes that have a lasting impact. We do this by providing data, evidence, and guidance for communities. We also work to gather and share stories of communities around the country that are at different points on this journey to serve as examples of inspiration for you and your partners. So again, today along the way, we're going to lift up some questions and ask for your examples, and really would encourage you to share those examples with us and with everybody else who's on the webinar. Our focus today is going to be an opportunity to dig deeper into our evidence resource, What Works for Health, At its core, What Works for Health is a tool to help communities make decisions about the strategies they can use to address local health priorities, and to do so without reinventing the wheel each time. So it really makes harnessing evidence easier for communities. So we hear the word evidence a lot. Maybe we hear evidence-informed. In our practice, we might use evidence-based. Sometimes terms like proven, model, and promising. And the word evidence has different meanings to different people in different organizations. And so before I dive into what evidence means for us at County Health Rankings and Roadmaps, I'd like to ask you to take a minute and think about what evidence means to you. And as you're thinking about what evidence means to you, I'd like you to think about what criteria would you like a physician to use in deciding how to treat you. And we're going to launch a poll, and you can select one or multiple answers. And again, we're thinking about what criteria would you like a physician to use in deciding how to treat you. Getting some great responses. Thanks everybody for joining in and sharing your thoughts. And we're going to end the poll in about 3 seconds. So last votes. All right, and I'm going to end the polling, and hopefully you're seeing the results. And so really you can see answers all across 1 through 5. And that's important, right? So all of these things come into play when we're thinking about how a physician might treat us. But when we at County Health Rankings and Roadmaps think of evidence, we really think about number 4 and 5, results of controlled experimental studies that show a method is helpful, and what they know by critically reading the literature in their field. And I'm going to stop sharing these results. And if you're still seeing those results, just go ahead and X that out. So I would just again emphasize that number 4 and 5 are important components, but as you all indicated via the poll, it's not the only thing that should be considered. So now we're going to just take a minute and explore the County Health Rankings model, and this helps us understand what drives health in a community. One of the goals we have with this image is to help change the conversation about health and what influences health. The model shows us that health is more than what happens at the doctor's office. It's a wide range of factors that influence how long and how well we live. It includes things that we often think about when we hear the word health, like health care and how well we eat and how much we move. But we know it's also about things like education and income, the quality of housing, and the safety of our neighborhoods. So let's see how this translates with a real life example. So looking to the light blue boxes and thinking about expanding early childhood education, which improves academic achievement. This results in higher graduation rates. And higher levels of education leads to higher levels of income, which make it easier to access healthy foods, clinical care, and quality housing, which in turn influence health outcomes. So I would just, again, emphasize that policy is at the foundation of this model, and you see that represented in the orange box. And this means that in order for everyone to have a fair and just opportunity to be healthy, we must redress policies that have caused health inequities. When communities do not thrive, their residents are not experiencing that fair and just opportunity to be healthy. So we're going to take a look at how What Works for Health can help you identify and find some of those policies and strategies. And within what Works for Health, those policies and those strategies are across the light blue boxes represented here in the County Health Rankings model. As I mentioned earlier, the goal of What Works for Health is to help communities make decisions about the strategies they can use to address local health priorities, and to do so without reinventing the wheel each time. Currently within What Works for Health, there are over 400 strategies. It's a living resource, always changing and being updated, and strategies being added as well. And so when I reference strategies today, I'm really referencing policy, programs, systems, and environmental change. So within each strategy, we include a menu of ideas, and I'm gonna, or not ideas, but we include a menu with some specific guidance. And so let's walk through what you can find within each strategy within What Works for Health. First, an evidence rating, which conveys the likelihood strategies will work based on best available resources. Second, you'll find a short literature summary that highlights who a strategy can benefit, what it can do, and as we have it, information about cost. We also include disparity ratings, which help communities use an equity lens as they explore strategies. And finally, we have implementation resources to move from idea to action. So let's take a look. Let's take a look at what an example of a strategy looks like. And for those who like to read through all the details, this is a tough slide, and in a few minutes we're going to go to a live demo where you might be able to explore this in detail a little more closely. What we do want to walk through is at the top left of your screen, you see a thermometer with the evidence rating. And this is the likelihood a strategy will work based on the best available evidence. You see the outcomes that we have in mind when we assign that rating. So in this example, scientifically supported for increased physical activity. And then you can see other potential benefits that pop up in our literature review. What this tells us is that Complete Streets is rated scientifically supported for increased physical activity and increased pedestrian and cyclist safety. So again, continuing to explore this example, if we were scrolling further down, we see the evidence of effectiveness, which is the meat of the write-up. And so this example is very truncated just to fit on the screen. But again, within the strategy, you see the disparity rating, as well as implementation examples and resources. And I think these implementation examples and resources are hidden gems, especially when you're thinking about considering if a strategy is a good fit for your local context. So I always encourage communities to check those out. I'd also lift up that the blue text throughout the strategy are links to the underlying resources we've reviewed when compiling the summary. And if you scroll further down, citations are available as well. So we're going to go to the live demo here in a second. But before we do that, I wanted to spend a little bit of time discussing our evidence ratings. And this is core to what we do and how this resource can be useful for you. So we have 6 evidence ratings, and I'm going to walk through them briefly. Strategies rated scientifically supported and some evidence have been shown to work. Scientifically supported is assigned to strategies with the strongest evidence, while those rated some evidence do not have as much evidence available. Strategies rated expert opinion or insufficient evidence might work. These are often the newest ideas or those that have been implemented for a long time, but not studied in a robust way. If you're using strategies with this evidence rating, we encourage you to share your story and your results along the way. And finally, at the bottom, you'll see evidence of ineffectiveness, which is assigned to strategies that have been shown not to work or cause harm. So I would just offer a reminder that these ratings are specific to the expected beneficial outcomes. And there are often other outcomes that may not have reached the same level of evidence. All right, and so we're going to transition here and go live with What Works for Health. And as we're doing that, we'd love to hear from you in the chat box how you've used What Works for Health to support your work. And hopefully those chats are coming in. I'm working on switching my screen over.
Thanks, Allie. We're looking for folks' responses to the question of how you've used What Works for Health.
Yeah, great. And keep those stories of how you of how you've used the resource coming in, and we'll check in on that after our live demo. So starting from, and I'm actually going to check in, Attica, are we seeing the website now?
Yes, we are. Looks good.
Great. Thank you. All right, so we're starting from the County Health Rankings and Roadmaps homepage. And you navigate to What Works for Health by clicking on Take Action to Improve Health. And then from here, you'll see these 3 boxes in the middle of the screen: what works, how to take action, and who to work with. And we're going to click on What Works for Health. So this is the What Works for Health landing page. And here, we're going to explore this a little bit. You'll see first, we can explore strategies by topic area. We can also do a keyword search, or we could select all strategies to see the strategies listed in alphabetical order. Continuing to scroll down, I really wanted to highlight these boxes using What Works for Health and choosing your strategy. As part of the registration, we got quite a few questions about where folks could go for guidance on using What Works for Health and choosing strategies. So I'd encourage folks to check out those 2 resources more deeply if that's something that's of interest to you. Underneath that, there's opportunity to explore in more detail our approach, the ratings, the methods, and other sources. Finally, going down towards the bottom, you can find featured strategies, and these are ones that we're lifting up and maybe have been new and updated. And finally, towards the bottom, I did want to lift up the What Works for Health strategies to improve rural health. Again, as part of the registration process, several folks asked for resources and wanting to explore more what's worked in rural communities, and the What Works for Health strategies to improve rural health report is a great starting place. So that's navigating the landing page, and I'm just going to scroll back up. And we're going to talk, now we're going to actually enter the What Works for Health resource and do a little exploring within that. So I mentioned that you can explore by topic, and this is a great way if you know the broad topic that you want to address but aren't sure which avenue to take. So really looking at the what, not the how. It allows you to search by individual health factors. And so, for example, if you're looking, so we're going to look at something related to transit. So I'm going to click over here, and I'm going to click on housing and transit. And so what you see now is that we've assessed 35 strategies in this area to date. And we can click on one of these titles to get more detailed information, similar to what we saw in the example earlier. And I'll just do that real quick. I'm clicking on bike and pedestrian master plans. And so again, we see the evidence rating. And it is handy when you look at the evidence rating, you get a reminder of those definitions. And then we see the expected beneficial outcomes. And again, this is just similar to the example that I shared earlier, going all the way down to the implementation examples and resources. So again, those examples and resources are great little, are a great way to explore context. So I'm going to go back out. So again, this was, we clicked on housing and transit, and we saw that there have been 35 strategies reviewed to date. Now, going a little deeper into how you might continue to filter this list. Maybe 35 is feeling too many. You don't have time to go through all 35, and you want to continue to refine your search. There are 3 ways that you might do this. First is by approach. So you could think about how you want to move the needle or what you want to achieve. Sometimes within our community transformation team, we think about this as goals. Next, we can filter by decision makers. And these are the stakeholder groups that can implement a specific strategy. They might be partners that you already have in your coalition or partners that you're seeking to engage as part of your work. This could be a good way to support reaching out to someone new. And then finally, you might consider searching by evidence rating. Maybe for the work that you're thinking about, you really want scientifically supported and strategies with some evidence. So you might narrow by evidence rating. I'll just note real quick that the numbers next to each one of these is the number of strategies. So if we were to click on, for example, we wanted our approach to be support active travel, which we're going to click on, it will take us to from 35 strategies to 10 strategies. So we've narrowed. And so finally, just want to lift up that you still see various ways to support active travel from community-wide policy efforts such as bike and pedestrian master plans, complete streets, and zoning regulations. If we were to scroll through this list, you would see changes to infrastructure such as bypasses and traffic calming efforts. And finally, more targeted efforts in setting more targeted efforts in settings such as schools and workplaces. And so I'd encourage you to think about how you can use the filters to narrow your search as you're exploring to learn more. So now I'm going to take us back out to the What Works for Health landing page. And just want to quickly demo what it looks like if you search by keyword. And so we're going to search by crime prevention. And just by coincidence, you see that there are also 35 strategies that have been reviewed with this keyword search as well. And again, this represents a range of ideas that you might want to consider reflecting opportunities at both the community and individual scale. So that again was our quick demo of What Works for Health and explores both how you can think about starting your search, but then also refining your search. And so I'm going to transition back to the slides. And as I'm doing that, Attica, I wonder if you can share some of what folks chatted in.
Definitely, Allie. We've had a number of chats, so I'll share a few of them. Liliana says that we have not used What Works for Health yet. Meredith says that evidence also includes scanning the local newspaper to see what's been happening for the past 25 plus years. Abby, they use What Works for Health to look at different strategies to use for their objectives from their community health improvement plan. Melanie, they use it for their community health improvement plan strategies as well. Liana, they're working with local communities to identify interventions specific to the developmental origins of health and disease. They've combed through What Works for Health database and developed a list of programs and policies, etc., that might be appropriate for communities to use as a starting point for their discussions to identify an outlet appropriate for their community. Roberta, their local hospital, has used What Works for Health in collaboration with a community coalition and health district to review and select potential evidence-based strategies to consider for obesity prevention in the community. Great. And David, yeah, he's at Habitat for Humanity, and they're looking forward to digging more into how some of these strategies can be used for their evidence-driven work.
Great. Well, and that's a perfect segue. And thanks to everybody for jumping in and sharing their ideas and experiences. It's lifting up exactly this, right? That communities use What Works for Health in many ways. One opportunity is to learn about policies and programs. It helps to get a sense of what strategies a community might want to consider to address a particular problem. We've heard from others that they've used What Works for Health to inventory current approaches. This helps in budgeting or strategic planning. It's a resource that can help identify which strategies to scale up and which to scale back. Other communities take a step beyond general learning and use What Works for Health to really help narrow down to the best strategies for them and to formulate a strategy for action. So again, just sort of underscoring what the audience has shared with us about their experience. And so now I am excited to continue the conversation by introducing Kelly Rodgers, who is the Executive Director of Streetsmart, a nonprofit organization developing an evidence-based transportation planning website that illustrates the effect of transportation strategies on community goals. Kelly has nearly 20 years of city planning experience in the public, private, and nonprofit sectors, working in a variety of areas, including green infrastructure and sustainable transportation. She is also a doctoral student in the urban studies at Portland State University. Kelly, welcome, and I'm so glad that you're here today to continue this conversation around the role of evidence in decision-making and sharing Streetsmart as another resource that lifts up evidence.
Great, thanks very much, Allie. And thanks for the opportunity to talk with you all today. As Allie mentioned, Streetsmart is a nonprofit research synthesis, resource clearinghouse, and communication platform for transportation. Our aim is to help shift the conversation of transportation from strictly mobility into access to goods and services, to help people connect the dots between their transportation investments and impacts that they have on the community, as well as increase transparency in decision making. Streetsmart, which is a prototype that we will walk through today, is being developed into a beta version in collaboration with the Institute for Transportation Engineers.
Great, Kelly. Thanks for that overview. I think maybe a great starting point would be for you to share a little bit from your perspective, what's the role of evidence in transportation planning and what's the standard of evidence?
Thanks. Yeah, I think evidence has got a very important role in transportation, and evidence can help illuminate a policy landscape and help civic leaders decide what solutions work best for their community. In transportation, evidence comes into play in a few different places. One is that we're moving more into a performance-based planning environment, and this is pretty new for transportation, of setting goals and measurable targets and outcomes for the plans and projects that they are being developed. And if you are doing that, you need to know which strategies are most likely to get you to your goals. Evidence features quite prominently in some of the transportation guidance that's used by planners and engineers. It is a particularly expert-driven, number-heavy world with a focus typically on vehicular data. So Streetsmart is aiming to kind of bring that some evidence and more evidence to the general public, as well as planners and engineers, to bring a little bit more parity to the conversation, to kind of equip them with the same tools that others have in more technical processes. And lastly, I just want to re-emphasize that I really want Streetsmart to help people connect the dots beyond just mobility, which has typically been and historically been the central concern of transportation, and look at the effects that it has in a number of areas, including health. And so some of the evidence today that's used in transportation, I just want to highlight 3 resources that are commonly used to kind of illustrate the situation that we are in. One is the AASHTO Green Book, and AASHTO stands for the American Association of State Highway Transportation Officials, and the Green Book is just the shorthand name for the policy on geometric design of highways and streets. This document offers guidelines that consist of best practices and is supplemented by research. However, that research has been focused primarily on vehicular travel, and it is designed really for cars. It accommodates pedestrians and bicyclists. It doesn't design for pedestrians and bicyclists. Generally, previous versions of guidance like this have actually talked about pedestrians interfering with traffic. That's a mindset that has changed a bit, but it does illustrate that the questions that we ask and the research that we perform does have a normative stance, and we need to think about the framing and what we're asking. I will add that the Federal Highways Administration has some great guidance that promotes active transportation, such as the document Achieving Multimodal Networks. The next resource is the Institute for Transportation Engineers, or ITE, Trip Generation Manual, which is used for local development to estimate the number of auto trips to a site based on the type of development that's proposed. This guidance has been very impactful on the shape of our communities, particularly around the amount of surface parking lots that we have and the nature of pedestrian facilities. So ITE's trip generation manual, the previous versions had been roundly criticized for using old data, being a convenient sample, that the data sites were not representative of the spectrum across the communities, and didn't reflect travel behavior theory. This guidance has been updated. The latest version of this manual is a lot more attuned to context, for example. So there is improvement, but this has been a really significant resource in shaping the way that we plan and design our communities. Lastly, we have 4-step travel demand models. And these are a series of models that calculate aspects of travel demand in a sequential fashion with limited feedback loops. So unfortunately, the outputs do not include bicycle or pedestrian trips. So this also sort of suggests the limitation that they have in the data that we're working with. The 4 steps are trip generation, trip distribution, mode choice, and trip assignment. And again, I mentioned that this happens sequentially. And the challenge is that people generally don't make decisions in a sequential fashion. So we may choose where we want to go and then decide what mode we will take to go there, by car or by bike or by bus. On the other hand, we may have already made a decision about what mode we are taking. We are taking the bus to work today, and therefore decide which destinations we will stop at for, say, grocery shopping because of that. So the travel demand models are very limited in being able to make predictions based on how people actually work. So there have been improvements to this, but there are still some kind of fundamental problems with how the models are organized. I just want to make a note of something that UCLA professor Donald Shoup once mentioned about the use of evidence in transportation. And he in particular was looking at parking requirements, but that it's better to be roughly right than precisely wrong. So evidence-informed policy and evidence-based practice, I will say in the planning world is not as well known as it is in public health. There are a lot of reasons for this. And partly it's because there's kind of been this rationalist planning history that we have steered away from in favor of collaborative planning. I think evidence-based practice is an opportunity to kind of integrate the best of both worlds. So some of the practical issues that Krycek and all found when they were looking at doing, integrating evidence into planning practice is for practitioners, it is very difficult to gain access to evidence. And some of you may be keenly aware of this. If you don't have access to journal articles, you don't have a subscription to an academic database, it's just not possible to get to the evidence. The other piece is knowing how to read the research. So some practitioners have training and understand the methods that are being described in these journal articles, but they may have forgotten some of that over time, or they were never trained in it in the first place. And then lastly, there's time. So the time to find it. Even if you had access, even if you knew how to read the research, these are dense articles. It takes a lot to get through it. So conceptually, the challenges from a more, academic perspective, I might say, is that you have a challenge of conflicting findings. So how do you know that the article that you've selected is not the outlier in the whole trend? And then how do you systematically compile multiple studies for different circumstances? So some of these challenges we can talk about further in the discussion if you're interested. Certainly systematic review is one of the methods that's used around conflicting findings. There are other methodologies that spend more time exploring context.
Yeah, thanks, Kelly. And as we transition over to your demo, I just wanted to lift up that those practical issues and conceptual issues that you raised up are things that we discuss also within our work at What Works for Health.
Yes, thank you. And I'd like to check and make sure that my screen is visible.
I am not seeing it.
Okay, I'm going to do a stop share and do a share again.
There we go.
Great. Okay. At this point, I'd like to walk through the Streetsmart prototype. Again, it's a proof of concept prototype. So this means that what you see here, it looks like a functioning website, but is actually filled with dummy data. And as I mentioned earlier, I'm working on a beta version with the Institute for Transportation Engineers to populate it with 3 sets of evidence and 15 strategies relating to outcomes of walking, bicycling, physical activity, vehicle miles traveled, and greenhouse gas emissions. So the way that Streetsmart is organized is by strategies and goals. Here, again, because this is anticipating a performance-based planning environment where we are trying to find strategies to meet our goals. What we have populated in the prototype is traffic calming. So this is the landing page. It has some pictures of examples of what traffic calming can look like, a description, some information about scale and context and cost. Of course, this will be an order of magnitude cost because context is very site specific. And then below that is the research synthesis portion of the site. So this is the performance dashboard. So this is the results of the empirical evidence of the relationship between traffic calming and these outcomes. And I did draw this from the literature, by the way, although I did not perform the systematic review myself, so I can't verify the information, but this is roughly accurate. It's communicating a lot of information here. So we have the direction of association, the certainty of the evidence, and the magnitude of the effect. And because that's a lot for the user to understand visually, I've developed 3 different views of this that we are testing with users to see which one is most understandable to them. 2 are in at a glance form, and 1 is less at a glance and requires scrolling, but it spells it out a little bit more in detail. And with that, if we have a poll, I'd be really curious to know which of these views is most understandable to you.
Yeah, and Kelly, as folks are chiming in with their responses, it looks like you're clicking through at various points. So right now it looks like view A is up.
This is view A. This is view B. And then view C is this longer list.
Great.
And Allie, I'll let you close the poll so you can let me know when it seems like the numbers are slowing down.
Yeah, I'm going to give folks about 5 more seconds here. We're still getting quite a few clicks, so let folks get in their last thoughts. All right, I'm going to end the polling and I'll share the results and let you walk through those, Kelly.
Great. Okay. So it looks like view C was the most popular by a hair. It was most legible to people, but view B was also pretty popular. What I am likely to do, this is very similar to some of the feedback that I've received, is I will probably keep one version of A or B or some combination modified version so that there's this at a glance view that it would be possible to download and to be able to insert into, say, a PowerPoint presentation to council or something like that, but also retain a version of C so that it's possible to scroll through it and look through it in more detail. Thanks, everybody, for weighing in. The section below is strategies that achieve similar goals. And so while Streetsmart is intended to be a decision support tool, there are a lot of educational components to it, and this would be one piece where I am encouraging the user to consider other options that might also achieve some of the same goals. I will remind you that this matrix is kind of randomly populated as a prototype, so don't take anything too literally. But the idea here is that you can explore what other strategies might work. So to go back up to the top, we're going to go to the next tab, which is the evidence tab. And here are the articles that make up the information in the performance dashboard. And where there's an article highlighted in blue, you can click through to it directly. In many cases, we will hit a journal paywall, which is not ideal, but also not mission critical. It's really about providing assurance to the user that the information that they see is backed by evidence. There will be a citation there, and so if you're very determined to learn more about the methods or the findings, you could always look that up. The last piece is implementation. So this section is kind of getting the user to think less about what works and think about how it works and what are the considerations going into implementing a plan or project. Who are the users? What's the history of the site? Who are your partners? Those kinds of things. And then below that are guides, plans, case studies, and model ordinances. And this will take you to other sites. So I, talk to other organizations and let them know that I'm trying to drive traffic to their sites to be able to get people to the resources they need to do their work. What I would like to do in the future in the beta version is tag these resources according to certain contextual features to provide a better and more tailored search for people, particularly for case studies, if it's a small city or a large city, what region of the country the case study is located in. Is it in a snowy region, for example, because people that live in snowy areas are often concerned about infrastructure and snow removal and if that will work, or if it's in a southern city and they want to see their peers, what their peers are doing in the south. The feedback that I've received from practitioners is that kind of peer matching is valuable to them. So I'll just quickly go over to goals just to say that this site is designed in a very similar way. This is maybe where more people are likely to start. They have a goal in mind and they are going to pursue that. So there's some more facts about why walking is something we care about, and then a nod to performance measures. So performance measures are a really important way of integrating health, equity, and many other concerns into a transportation plan or evaluating a transportation plan or project. So this has a little bit of information in the future. If you were to click on this, would say, this is what this metric mode choice is about. This is how you measure it. This is the data that you use, and some examples of how it's been used. Below, we have strategies that affect walking. This is the flip side of that performance dashboard. These are the kind of things that tend to improve walking based on the research. And everything else is basically the same. We again have more questions about implementation, which is including, how have you engaged with residents in the community about a walking plan, guides, plans, case studies, tools in this case around how to measure walkability in your neighborhood. And then finally, a list of organizations that are working on this goal. So this would be national level nonprofit organizations that have more resources and information to offer on this subject. So with that, I will end the prototype walkthrough portion of my presentation, and we will go back to the slides.
Yep. And Kelly, thanks for that quick walkthrough. I'm wondering if you could share, maybe just to highlight, one or two of these benefits with our audience about the benefits of Streetsmart.
Sure. So based on the conversations that I've had, I've learned the different ways that Streetsmart could be used. One is to get everyone on the same page. Because we're working with so many different audiences, we have planners, engineers, public health professionals, advocates, interested public, elected officials. Everyone has their own language and their own approach and way of thinking about this. And so developing a common framework for understanding is sometimes one of the most challenging and parts of the transportation planning process, and Streetsmart can help with that. The other piece is to prioritize among investments. There are a lot of options when you're trying to think about how to improve walkability, and so it's helpful to look, as an example, it's helpful to look among all these other options and see what's most likely to help them reach their goal. Another thing is the case studies and being able to learn from others or in other transportation guidance. Case studies consistently come up as a very highly valued resource to be able to understand what were the key elements for success. Making the case is another way of using Streetsmart. Advocates in particular sometimes feel like they need to have more facts and fact sheets to bring to the conversation. Again, I mentioned it tends to be a very number-heavy world in engineering and modeling that they operate in. And so we're trying to provide a little bit more evidence to support the kinds of outcomes that they want to see in their community. Then there's evaluating trade-offs, and the performance dashboard is particularly good for this because you see at once the different impacts that a strategy can have. And some of them may have consequences that you don't want, and so it can spark a conversation among stakeholders around what is most important for their community. Defending innovation and decisions is a particular concern for decision makers. They want the evidence to kind of back them up. And then lastly is to inform a research agenda. So by virtue of highlighting which strategies we have less evidence on, this signals to researchers where we need to do more work.
Great, thanks, Kelly. I really appreciate that. And I'll let you just close it out. I think you're going to let people know that they could contact you.
Yes, feel free to send me an email and follow up with any comments or questions. I also have the link to my homepage where you can find the prototype. There's also a link to a survey, so if you want to explore the prototype further and leave comments, that would be a great place to do it. And lastly, I will note that I am hosting a couple of public health focus groups in August, and if anyone is interested in participating in a focus group so I can better understand the needs of public health professionals and how they want to engage in the transportation planning process, that would be great. So just drop me a line and I'll get in touch. Thank you.
Thanks, Kelly. All right, I'm gonna close this out with a couple of final remarks, and first wanted to spend a little bit of time talking about an approach that we think of as evidence plus, which is really, and you heard me mention this a couple of times during the demo, connecting the evidence of effects with your local culture and context. And you'll find content or clues to support this approach as you explore what works for health. And so during your exploration, ask questions like, does this strategy work? Will it work here? Then look at the details. Evidence ratings show the likelihood a strategy will work based on the best available evidence. Expected beneficial outcomes show for which outcomes. Confirm that, so then you want to confirm that these outcomes matter to you. Reading the evidence of effectiveness strategy can help you know if it matches and might work locally. Do you see populations like yours or communities like yours? The next thing to consider is the disparity rating, which indicates the likely effects on disparities or gaps in expected outcomes. And finally, implementation examples to help connect to your local context. Couple of key takeaways we wanted to lift up. Evidence is an important part of the decision making, but it's not the only part. What works for health provides information about what works, what might work, and what doesn't work. Connect the available evidence with your local culture and context to maximize effectiveness. As you are seeking to match your local culture and context with strategies, be sure to look back at the evidence of effectiveness summary and the implementation examples and resources. They give you a great starting point, and of course, be sure to reach out to stakeholders in your community to understand local needs and the assets and resources you have to address those needs. So here in a minute, we're going to turn it over for Q&A, but before we do that, I wanted to offer up the link to join us in the discussion group that we've mentioned a couple of times. And this is an opportunity to continue the conversation. So we've had such a great overview of how evidence can support and inform decision making, and we've explored 2 resources. And so we're going to create a space to dig a little deeper right after today's webinar. We'll open a Zoom meeting room, and you'll have the opportunity to join that interactive face-to-face discussion facilitated by Joanne Lee. So the link should be in the chat box, and I know Kelly and Jessica are both planning to join the discussion to continue to answer questions you may have about Streetsmart and what works for health. And Attica and Joanne will also be over there in that group as well. So we're launching a poll now to help us hear what you might want to talk about within that discussion group, or just where you'd like to continue to hear more about the conversation we've had today. And so we're going to give folks, again, you can select more than one, but where are you interested in hearing more? And I'll also let everybody know that on our next slide will be Q&A, so getting ready for that. And don't forget, if you're able to stay with us, to capture that link to join the discussion group. Still lots of great audience participation. I'm really appreciating that. Thank you all for sticking with us and engaging with us as well. All right, I'm going to give about 3 more seconds. And so, you know, it looks like a nice little spread, but really that second choice, ways in which you can connect the evidence with your local culture and context, was of interest to a fair number. So I'm going to stop sharing, and then I'm going to turn it over to Attica to help facilitate some of the questions that have come in today.
Thanks, Allie. Excellent work by you and Kelly on today's webinar, and you generated a number of questions. So I want to start with some of the questions that were directly for Kelly. So Kelly, the first question is, when will the Streetsmart website be up and running with actual data?
Right. It will take about a year to build the beta version with the 15 strategies and the 5 outcomes that I mentioned. I am in the process of having conversation with foundations right now about getting the funding to do that. So if there is anyone that has any suggestions about that, feel free to get in touch with me. But the actual construction of the beta will only take a year once I have the full funding for it.
Great, thank you. The next question is somewhat related, and the question is, how often is Streetsmart updated?
Yeah, so Streetsmart will be updated kind of rather than article by article basis, more of a systematic review by systematic review basis. So once the beta version is complete, I will continually add more existing systematic reviews on other topics related to transportation and community goals, as well as updating it with relevant case studies and guidebooks as they come up. So it'll actually be kind of a continuous and iterative process, although there will be more incremental chunks of research that get included based on when systematic reviews come online.
Okay. And this is a somewhat related question, Kelly, which is, have you chosen the beta cities already?
Well, that's a great question. I would love to entertain some conversation around that because I haven't yet. And so what I will be doing is piloting this with cities after it's complete. And I'm also interested in talking with cities or other agencies about being involved in the development process. So focus groups have been extremely helpful for me in terms of getting feedback and understanding the needs of all of the users. But if we could actually have a workshop and kind of work through it live with paper and pencil, I think that will produce a better product and will get the concerns of the users directly into the tool and kind of help them integrate it into their daily practice.
Great, thank you so much. I'm going to switch to Jessica, and I may come back to you if we have enough time, Kelly. But Jessica, there was a question about the data. So the question is, where is the data that establishes the link between employment and improved health outcomes?
Well, that varies based upon what strategy you're looking at. So within each of our strategies, we reference the empirical literature that's out there. And by that, we're looking at the peer-reviewed literature, systematic reviews, quasi-experimental studies, randomized control trials, that sort of thing. So that's going to vary based upon the studies, how they were conducted, who conducted them.
Okay, great, thank you. We also had another question around the evidence rating. So the question is, why are evidence-based programs important? Why can't people go and build a culture of health based off of creative programs or initiatives?
Well, as our attendees may know better than I do, we all have limited time and resources available to us, and so we want to use that time and the resources as effectively as possible. Using evidence to help inform the programs and policies that we select can help us make the most effective use of time and resources by focusing our efforts in on what's been shown to work and staying away from what's been shown not to work. When there are programs that haven't been proven or don't have solid evidence, or where there aren't any evidence-based programs that meet the goals that we're looking for, there's an opportunity to lean on what evidence is available to meet those goals and shape new and innovative programs and policies.
Thank you, Jessica. And then the last question that I have for you is, what are the ways in which decision makers can include evidence in their strategy selection as they're working to support local change? And this might also be a question for Kelly as well.
Decision makers can go in and actually, one of the search options on our website is, of course, to search by decision makers and to go through the search process as Allie demonstrated before. And by collecting the available evidence that they can find, they're going to be able to use that to present to their audience, whether it's fellow decision makers or their local community, to help them choose what's going to work for them.
Great, thank you.
I can add to that. What I have come to appreciate about decision makers, well, I'll say specifically elected officials, what I've learned from engineers and planners is that every elected official has a different agenda and a different concern. And so it's really helpful to be able to frame the plan or the program in multiple ways, and that's where co-benefits are handy. And so it's one of the reasons that I'm kind of use the performance dashboard, but what works for health also has other potential co-benefits, so that you can kind of sell one aspect of a plan or a project more strongly to one official, and then another dimension to another official as it suits their interests. As I mentioned before too, the whole alignment piece is really important. I think for elected officials to be able to get them some information very quickly is really key, because they don't have a lot of time to, more than anybody, have time to really look into the research or what works in much depth.
Great, thank you so much, Kelly. And you had one last question, which is, what is the role of public transportation in the Streetsmart effort?
Attica, I'm actually going to ask that maybe we hold that question and carry it over to the discussion group and see if there's interest, because we are at time and want to be respectful of our audience.
Sounds good.
But it was a great question, and I'd be curious to hear how that conversation goes. We do have the link up in the chat box, so if you're interested in continuing and joining the discussion group, join Kelly, Joanne, Jessica, and Attica. And with that, we always just like to make sure we close with the opportunity to stay connected with us. We really enjoy hearing your stories from the field and learning and continuing to grow with you. So please stay connected with us. And with that, I'll say thank you, everyone. Thank you to Kelly for sharing her time. Thank you to the audience for joining us. We'll see you next month.